When you take a Kendrick splint out of the bag, you're usually in a hurry because you want to splint a child's fractured femur as quickly as possible. Then you get the thing out and you look at it and it's like some kind of weird Meccano set and you just don't know where to begin with it, especially if you haven't done it for a while. I'm going to talk you through a systematic way of getting out, setting up and applying a Kendrick splint so that next time you can do it quickly and efficiently. We use Kendrick splints for mid-shaft fractured femurs. They are excellent at reducing pain, reducing blood loss, and reducing further tissue damage. Just be aware that they are contraindicated if you've got a lower leg fracture. So if there's a child with an associated tib-fib fracture, you can't use a Kendrick splint for them. They can be used for children who've also got a pelvic injury or potential pelvic injury. Just make sure that you've got the pelvic binder on first and then the Kendrick splint is applied over that. Check your kit to start with. First of all, you'll have a long pole that comes in sections connected with elastic down the middle, like one of those joke magician's ones. It's also got a plastic hook at one end, and that's going to be the foot end. You'll have a groin strap, which has got one of those squeeze-release plastic clips on it, and a plastic section for two poles to clip into. There'll be a stirrup type strap which goes around the ankle and foot, and you'll see that that's got 3 pull tabs on it in red, yellow and green. That's going to go on the foot and around the ankle. There'll be 3 additional straps for the thigh, knee and calf, and they are usually labelled red, yellow and green respectively, although they may have labels on them telling you where they need to go. It's usually pretty obvious. The bigger one goes around the thigh and so on. Putting on a Kendrick splint is a 2-person procedure, so do make sure you've got enough pairs of hands. It's also a painful procedure. Even though it's going to provide significant relief once it's on, actually getting this leg in traction is quite painful. So do make sure that the child is either sedated or they've had a nerve block or a really good analgesia, usually an opiate. Put the ankle strap on first and make sure that the Velcro is firm but not too tight. Have the green strap like a stirrup underneath the child's foot and pull the tab so that it's again fairly firmly underneath the heel. This is the bit that's going to help you to provide the traction later. Get the groin strap in place next. Really, this whole procedure should be done without lifting the leg at all, or if you need to, really only minimally to reduce pain. Thread the groin strap under the child's knee so that you don't have to lift the leg, and then just very gently wiggle it up under the thigh so that you can get it as high as possible under the buttock and up into the groin. Do the clip up and tighten it so that it's really snugly into the groin and over the pelvic crest. Make sure that the plastic section that's going to clip the poles in is on the lateral side of the leg. At this point, before you tighten, just make sure that you've moved the child's genitals out the way. Really important not to be crushing any important parts at this point. And in older children, just be sure that you're not catching any hairs under the strap. That's really going to be incredibly uncomfortable. And quite frankly, they've got enough to worry about as it is. Measure the pole so that you've got one additional section extending beyond the length of the leg. Some poles are gold with just one black section at the end, in which case you just want the black section beyond the end of the foot, and the plastic hook is going to be at the foot end. If you need to change the length of the pole, then you can just pull it apart, fold it over on the elastic and get it to the right length. Once you've done that, then you just clip the ends of the pole into the plastic clip at the groin end. Next, take the knee strap, which is usually marked in yellow, and wrap it around the leg, including over the pole, just under the knee. Hook the yellow part of the foot stirrup strap over the hook at the bottom of the pole, and then have one person stabilise the leg and the pole as the other person pulls the red strap to apply traction. This is the painful bit, so do warn your patient if they're conscious, and also be ready to top up their analgesia. What we're aiming for is to apply enough traction that you can see that obvious deformity is reducing and that the legs are now equal length. So just apply firm traction until that happens. Then you can apply the thigh strap, which is usually red, just above the fracture site, again over the pole, and then take the calf strap and apply it over the leg and the pole just above the ankle. That's usually the green one, so you've now got red, amber, green going down the child's leg. At this point, you should do another pulse check, check their neurovascular status. If the child is conscious, you can also just ask them about sensation. Hopefully, things will have improved, or at least not got worse. Children can obviously go to X-ray with the Kendrick splint on, and they can also go through the CT scanner with the Kendrick splint in place. This is a really good way of getting the child in traction pretty quickly to reduce pain and to reduce blood loss and further tissue damage. Then you can hand them on to your orthopaedic team for more definitive management. Hopefully you found this useful. If so, please do have a look at some of our other procedure videos. Thanks very much.